Hello friends, today we are going to discuss here about MRCP Part 1 Psychiatry MCQs from 16 to 20. 1 to 15 I already discussed. So, a 51-year-old man is unwell on day 2nd, attempted home detox from alcohol. He brought to emergency department by his partner who is seeking help. Diagnosis delirium tremens is suspected. Which single feature is most suggestive of this diagnosis? So, in delirium tremens, which one of the following is a single most diagnosis? Clouding of consciousness, jaundice, suicidal thoughts, sweating, or tremor. So, guys, in case of delirium tremens, clouding of consciousness, suggestive of diagnosis. Delirium tremens is an acute confusional state secondary to alcohol withdrawal and is an emergency medical condition requiring inpatient care. Complicated alcohol withdrawal, there is clouding of consciousness, disorientation, retrograde amnesia, psychomotor agitation, hallucination, and marked fluctuations. It occurs in 5% those with alcohol withdrawal with a peak incidence at 48 hours. It has mortality rate 10% now. An 83-year-old woman with severe Alzheimer dementia, lives in nursing home. Staff reports that she is stable, present no problem them. Her MSE2 score is 9/30. Her list of medication is being reviewed. Which single medication is most appropriate to stop first? Cocodamol QDS dose, donepezil once daily, olanzapine 5 mg at night, simvastatin 20 mg at night, or temazepam 10 mg at night as needed. So the single best answer here is simvastatin 20 mg at night. Now, visual hallucination are one of the three core features of Lewy body dementia, like visual hallucination, fluctuating cognition, and spontaneous feature of Parkinson's disease. Falls and syncope are often features of this presentation. Lewy body dementia but are not specific for diagnosis. Falls often occur because the patient gait and balance are affected. The motor symptoms of Parkinson REM sleep disorder is common symptom of Lewy body dementia, which can be very tricky to manage. Patient complained of vivid dreams, relative noticed disturbed sleep at the time, disorientation and wandering night associated with odd behavior. However, is not one of the core symptoms, and so this is not the strongest indicator of diagnosis. Severe neuroleptic sensitivity refers to common reaction these patients can have to any psychotic medication. They can become acutely confused, experience extrapyramidal symptom, and have an increased mortality rate. Word finding difficulties are often presenting features of any dementia and do not indicate Lewy body dementia in particular. Now, 54-year-old man is found on street drowsy and vomiting. Man is drowsy and vomiting. He uncapped with a strong odor of alcohol. Ataxic, verbally aggressive, slurring of words. Ataxic, verbally aggressive, slurring of words. Temperature is 37.5. Heart rate 96, BP is okay. Which is the single most appropriate diagnosis to exclude? Alcohol intoxication, alcohol withdrawal, aspiration, pneumonia, head injury, psychotic episode. So guys, in his situation, first exclude head injury. Now, head injury is the most important life-threatening complication of alcohol misuse that the doctor must exclude in this challenging but common scenarios. Often head injuries have occurred but may not be reported by the patient. Alcohol intoxication might explain the clinical scenario, but unlikely to be life-threatening unless there are physical comorbidities or alcohol has been combined with drugs. Now, 74-year-old man feels tired during the day but doesn't know why. Wife says he is overnight fighting with the bed sheet. At this time tells her he can see snakes. They have put padding on the bedside table to prevent injuries. Which is the most likely diagnosis? Alzheimer, dementia, delirium, harmful use of alcohol, psychosis, or REM sleep disorder. So, guys, this is a clear cut scenario. Overnight fighting with bed sheets, and he can see snakes, daytime tiredness, and her wife put padding on the bedside table to prevent injuries. So, this is a case of REM sleep disorder. REM sleep disorder. People can injure themselves and others without being awake during very vivid dreams. When normally atonic muscle become active during REM sleep, dream sleep, it can be presentation of Lewy body dementia. Treatment is often clonazepam or other sedatives. It is also important to consider the risk of injury to the patient and their bed partner. People with Alzheimer dementia do often. So, guys, I hope till here it's clear. If you like this video, put like on it. If somebody is new on my channel, please subscribe this channel. Thank you.